Namaste. Please remember, September is Suicide Prevention Month. If you ever need anyone, reach out and message. I would like to share the National Suicide Prevention Lifeline. We can all help prevent suicide. The Lifeline provides 24/7 free and confidential support for people in distress, prevention and crisis resources for you or your loved ones, and the best practices for professionals. 1-800-273-8255. Again, the National Suicide Prevention Lifeline, 24/7, free and confidential support, 1-800-273-8255. 1-800-273-8255. The National Suicide Prevention Lifeline is a national network of local crisis centers that provides free and confidential emotional support to people in suicidal crisis, or emotional distress, 24 hours a day, 7 days a week. We are committed to improving crisis services and advancing suicide prevention by empowering individuals, advancing professional best practices, and build awareness. We all wonder what really happens when you call that lifeline. First, you will hear skilled and trained. First, you will hear an automated message featuring additional options while your call is routed to your local Lifeline Network Crisis Center. Then we will play your little music while we connect you to the skilled, trained crisis worker. A trained crisis worker at your local center will answer the phone. This trained person will listen to you, understand how your problem is affecting you, provide you support, and get you the help you need. Lifeline Center calls are free and confidential, and we are available 24/7. The National Suicide Prevention Lifeline 24/7 is free and confidential support. The number is 1-800-243-8255. Remember, September is Suicide Prevention Month. If you ever need anyone, reach out and message. Continuing the torch with focus on youth and suicide prevention, we meet today on the World Suicide Prevention Day, September the 10th, 2020. I also would like to bring on our bright and brilliant youth leader of the Lead America Foundation, Sanjana Yenluri. Sanjana has been a 3-time beauty pageant winner, a 2019 National American Miss Maryland Junior Teen, runner-up at 2019 Nationals American Miss NAM Junior Teen Pageant Competition, 2017 National American Miss Maryland Preteen, 2015 National American Miss Maryland Junior Preteen. Well, she's multi-talented and a sports champion too. A university basketball player for Northwest Jaguars and field hockey captain. Her life goals is to become a pediatric oncologist and a successful entrepreneur with a deal on a Shark Tank. Sanjana, please lead the show with spotlight on suicide prevention awareness. We understand that every struggle is different. Let us save lives together.
Thank you. Hi, everyone. I am so delighted to be here today and kick off this exceptionally important event tonight, where the Lead America Foundation joins the American Foundation for Suicide Prevention in advocating for suicide prevention. The LEAD in Lead America stands for Youth Leadership, Education, Advocacy, and Diversity. I am Sanjani Lurie and a high school student, sophomore from Boyd's, Maryland, USA. I am part of the National American Miss Pageant System, where I received 3 Miss Maryland titles, and am recently a runner-up at the National American Miss competition. Through these events, I am blessed to have the opportunity to learn from and inspire young adults to grow into compassionate and well-rounded global citizens. Aside from pageants, I'm a varsity basketball player and the captain of my field hockey team. And today, I'm here as a youth leader to learn and make others aware of suicide prevention. I have an urgent request that you tune in to further understand the importance of suicide prevention this month. Furthermore, this day, so we can work together to save lives. This is a really big deal to me, and I hope it is for you too. September is Suicide Prevention Month, and today is a Global Suicide Prevention Day. We must urge people in the spirit of volunteerism and come together as one to prevent people from causing harm to themselves. Live their life to the fullest extent, especially during times like this. We all have a lot of challenges to deal with. COVID-19 and social justice, just to name a few, have caused a tremendous amount of stress and anxiety among us. These are times when where our conviction and determination is tested the most. Very recently, I had the opportunity to talk about transforming the future of education from the role of teachers, parents, and students at Dr. Kalam's memorial webinar conducted by the esteemed Lead India Foundation. The COVID-19 pandemic has caused a tremendous amount of stress among 3 stakeholders: parents, teachers, and students. I, along with many other students, would much rather be at school right now, talking to friends and having fun. However, for all good and especially safety reasons, we are rather restricted and confined to virtual spaces and rooms. The online virtual model serves as the best, and during these times, the only model has definitely been difficult, if not for all, for sure for some of us. We, meaning parents, teachers, and students, need to acknowledge and adjust to the new normal and be sensitive in ways we conduct ourselves at home and online. By coming together, holding hands, being compassionate, meditating, exercising, we can and for sure will be able to reduce stress and anxiety. Last but importantly, be vigilant for those among us who are vulnerable and help them get through these and potentially other stressful times ahead of us, and help ourselves lead complete, productive, and fun lives. We are all in this together. We only get one chance to live once. Let us live to the fullest while having fun. Please remember, September is Suicide Prevention Month. If you ever need anyone, reach out and message. I am proud to be a member of this incredible Lead America Foundation. I'm so glad and thankful to Mr. Rajesh, an inspiring and versatile leader in various fronts, has introduced me to this great organization. I can't wait to work more for and with this foundation. And if you're wondering what it's all about, let me tell you. The Lead America Foundation is a united national diversity coalition of America. It's an apolitical, nonpartisan, pan-American, all-volunteer, socioeconomic give-back, all-volunteer US 501c, nonprofit organization to champion youth leadership, education, advocacy, and diversity. At the Lead America Foundation, we host focus group panel discussions driven by qualified healthcare professionals and subject matter experts to benefit youth and family wellness. The Lead America Foundation is committed to transforming lives one person at a time. Here, we open doors, find answers, meet challenges, and develop resources. We recently concluded several youth and family wellness-focused events on teen suicide prevention, bullying and depression, etc. Our goal is to demystify, decode advocacy by equipping society with knowledge and tools. We help communities become assertive to pursue and promote active engagement in a progression by giving the confidence to advocate effectively. Lead America Foundation volunteers stepped up during the COVID and distributed food groceries to over 10,000 families by organizing food drives in the DMV area. And we will continue to give back to the community, especially the minorities and the economically disadvantaged communities. We donated $8,000 worth of food and hygiene items to Loudoun Mobile Hope, and donated $2,000 to the Munna Food Pantry, $2,000 to the Blue Ridge Wildfire Center, and $500 to American Foundation for Suicide Prevention. The Lead America Foundation shares values, ethics, morality, integrity, and compliance. Human and social justice advocacy has been defined as systematic efforts aimed at influencing public attitudes, policies, and laws to create a more socially just society guided by the vision of human rights that may include awareness of socioeconomic inequities, protection of social rights, as well as human identity, experience of oppression, and spirituality. The Lead America Foundation is proactive in hosting youth-focused family wellness and mental health services. Volunteers at the UNDCA and mental health first aid certified professionals ignite debate and discuss solutions by engaging panel speakers of the United National Diversity Coalition of America. The Lead America advocacy is a process of supporting and enabling people to A, express their values and concerns, B, access information and services, C, defund and promote their rights and responsibilities, and D, explore choices and options while imploring and forcing change. The Lead America Foundation in all its forms seeks to ensure that people, particularly those who are most vulnerable in the society, are able to have their voice heard on issues that are important to them, defend and safeguard their rights, and have their views and wishes generally considered when decisions are being made about their lives. We are self-funded and an all-volunteer-driven nonprofit system. I am beyond thrilled to be a part of Lead America, and I can't wait to work more with it. Please join our foundation, help us make a change, and help us save lives. Now, it is my great honor and pleasure to introduce our distinguished panel of guests, Dr. Adityan, Dr. Mohan Karetti, and Ms. Sirisha Kampali. It is my honor to first introduce Dr. Adityan, who is a thinker, author, researcher, and a physiatrist with over 3 decades of experience in mental health and saving lives. He is based in Ohio, and his current clinical positions include the Executive Medical Director at the Nirvana Health and Wellness, the Psychiatric Medical Director at the Psychiatric Clear Vista Health and Wellness, and the Medical Director at the Recovery Institute of Ohio. His current academic positions include the Associate Clinical Professor at the Pennsylvania Program, Baldwin Wallace University, and the Assistant Clinical Professor at the Psychiatrist University of Toledo School of Medicine. His medical licenses include a medical license from the Ohio State Medical Board. As for his educational qualifications, some of his many include the MRC Psych as the membership examination of the Royal College of Psychiatrics in the UK, the DIP-AB, Diploma in Addiction Behavior, and the MBBS, Bachelor of Medicine and Bachelor of Surgery. Special honors include nominated for Clinical Excellence, Awards for Physicians, Excellence in Teaching Awards in 2001, Excellence in Teaching Awards in 2000, Consultant, Guest Speaker, Dayton VAMC WSUSOM Excellence Award in 1996, and the Vice President of Medical Staff Organization in 1994 to 1995. He has a tremendous amount of clinical and teaching experience. Now for Dr. Mohan Karetti Md is a pain management specialist in Medina, Ohio. He is board certified by the American Board of Pain Medicine. Dr. Mohan is very familiar with the vision, mission, and goals of the Lead America Foundation. He is part of our think tank and has earlier headed an event that we had hosted at the Thomas Jefferson Institute of Technology against the backdrop of losing a young student to suicide. He headed our medical panel and shared ways and means to cope with the loss of a loved one. We really appreciate his engagement and encouragement. Dr. Mohan is a pain management specialist. He has been practicing anesthesiology, internal medicine, pain management, and pain management in Medina, Ohio, and is affiliated with multiple hospitals in the area. He has been in practice for over 3 decades. Dr. Mohan primary focus as provider in substance abuse and treatment services, mental health treatment services, and general health services. Dr. Mohan is the American Academy of Pain Medicines. Pain management doctors specialize in caring for patients who are dealing with chronic pain, whether resulting from injury, disease, or otherwise. Dr. Karetti creates customized pain management plans for patients that may include therapy, medication management, or minimally invasive procedures. When creating a customized pain management plan, Dr. Karetti will evaluate the patient and their medical history, in addition to performing tests to arrive at a precise diagnosis. Ms. Siri is the president of Logis Inc., an IT services firm headquartered in Washington, D.C., to provide solutions to the private and public sector with a focus on state and federal government agencies. She is committed to serving the community as a volunteer in various leadership capacities. Ms. Siri is proud to be associated with the Lead America Foundation, the IDRF, India Development and Relief Foundation, the Director of Media and Outreach for U.S.-India SME Council Organization, Yo-Yo TV, Media Coordinator, and RJ for Radio Zindagi, as well as Piluputv and a few others. Apart from engaging directly with several nonprofit or community service-centric local, national, and global organizations, Ms. Siri personally conducts food and clothes drive in the DC metro area and regularly volunteers to donate hair and blood while encouraging others to donate as well. She is a very well-known gardener with a true green thumb, focused on healthy cooking and healthy living. She is a chef and a foodie too, and appeared on many cookery shows. Ms. Siri takes pride in initiating, supporting charity, and fundraising events for our community, including uplifting lesser privilege in women, including establishing helpline support for women in need. Finally, her favorite quote, "We don't inherit the earth from our ancestors. We borrow it from our children," a Native American proverb. Ms. Siri advocates for discover nature, discover yourselves. Again, it is my pleasure to introduce Ms. Sirisha Kampali, an extremely successful professional and an inspiring persona. We can all look up and learn from her. And please remember, September is Suicide Prevention Month. If you ever need anyone, reach out and message. Thank you.
Thank you, Sanjana. Thank you so much. Let us try to engage in the digital discussion hosted by the Lead America Foundation with the American Foundation for Suicide Prevention and digital media partner, Piluputv. This month in September, in fact, all month of September, for mental health advocates, prevention organizations, survivors, allies, and community members, we all unite to promote suicide prevention awareness. We are in this struggle together. We are in this battle together. We are going to commit to save lives together, one life at a time. LAF, that is Lead America Foundation, Prevention of Suicide Mission to save lives and bring hope to those affected by suicide. An incisive presentation on mental health and suicide prevention includes the most up-to-date suicide data and research, and what can be done to fight this leading cause of death. Participants will learn the common risk factors for suicide, how to spot the warning signs in others, and how to keep ourselves and our loved ones and those in our community safe. We would like to highlight suicide from the community perspective, especially our children, parents, and teachers. Our Lead America Foundation youth leader, Sanjana, has just introduced to each of you and stated the challenges of transition of different learning due to the pandemic and measures we are forced to take to adapt. This has set the tone to address the loss of human touch and consequently empathy and other human values, which likely can impact mental health and well-being too. We'll share a few resources as well. The Lead America Foundation, a United National Diversity Coalition of America, is directly confronting challenges faced by the local families and is committed to transforming lives one person at a time. Our community engagement, health and awareness, and wellness events are free, open to all races and all ages. Please join and engage to pay it forward with partnerships. And thank you to all the volunteers of the Lead America Foundation who offer spirited help and contribute their time, talent, and treasure. The Lead America Foundation hosts and invites Dr. Adityan Ji.
Namaskar.
Namaskar. Remember, September is Suicide Prevention Month. If you ever need anyone, reach out and message. Thank you, Dr. Adityan Ji.
Namaste. Thank you very much indeed to Lead America Foundation, Sanjana and Siri for this warm introduction. I would say that as a psychiatrist and as a mental health professional, you guys are doing an excellent job doing community work, having a suicide prevention hotline, because in the business of saving lives, that's the first crucial link. If that crucial link is not there, things can be very, very difficult and different. The outcomes can be very different. So I salute you guys for running, the community awareness program, as well as a suicide prevention hotline or assistance line, which people can call when they are in distress. As a psychiatrist, as a practicing psychiatrist almost now for 40 years, suicide is a very, very complex phenomenon. You cannot stereotype, you cannot generalize. There are individual reasons, there are community reasons, there are societal reasons, there are family reasons. But it is a great mental health challenge and a problem. At this point in time, it is the 10th leading cause of death in the United States. There are 48,000 individuals every year who die by suicide. 50% of them actually kill themselves with a firearm. The suicide rates are slowly increasing in the United States, and that is a matter of concern. Most of the time, if help is given early, people can be engaged, crisis resolution is done, we can prevent a lot more lives than 48,000 a year we are losing. So the efforts of community organizations in raising awareness, education, in reducing stigma, in enabling people to access the services, mental health services, is a great contribution. Time and again, people do call in distress, some sort of suicide prevention hotline or sometimes a sort of crisis hotline. And that is the most, life-saving intervention that can be done, those few minutes. Those few minutes of intervention by a trained counselor can make a difference between a fleeting suicidal idea versus a completed suicide. Since this program is focusing on youth, I would tell the young audience that suicide can afflict you irrespective of your age, your gender, your ethnicity, your educational status. Nobody is immune. I think we need to talk about it. We need to reduce the stigma so that people are not discouraged from seeking help they need. A lot of time, people may have undiagnosed mental health issues. There are very common psychiatric problems that manifest in form of suicidal ideations, commonly being depression, major depression, bipolar disorder, schizophrenia, certain personality disorders, alcohol and drug problems. They are a leading cause of suicidal ideation as well as suicidal behaviors and completed suicides. And pretty much all these mental health disorders can be successfully treated. Their symptoms can be controlled. People can be returned back to mainstream society with a productive life if they are given the choice of treatment. So initial crisis resolution is very, very important. A majority of the time, people are undergoing some sort of crisis. Once they have had time to reflect, time to deliberate, the equity of suicidal ideation probably can be dissipated or ameliorated. So having these trained crisis intervention service or a hotline or community awareness or community education programs are the most important link in saving lives, because you guide the people to appropriate treatment services and curative services. It's granted that psychiatrists and mental health experts may not be able to prevent 100% of the suicides. But as a psychiatrist, I would say, even if we save one person's life, that is good enough. If we are not able to prevent 100%, even if we prevent, let's say, 90%, I would put my money on that and put more investment of resources, whether fiscal, whether personnel, human resources, into these kind of efforts. So the message to young people is that don't shy away from talking if you're having a crisis. Find someone you can confide in, seek services, seek counseling. If you are suffering from a mental health issue, if you have drug or alcohol problem, seek help. The sooner you seek help, the better are the outcome. You know, a lot of people have gone through this kind of crisis multiple times in their lives. And they realize in hindsight that some amount of help was able to, steer them in right direction. Not everyone who commits suicide is actually successful in the first instance. So there's a definite role for counseling, there's a definite role for crisis resolution, there's a definite role for treatment of mental health problems, whether these are serious diseases like major depression, schizophrenia, bipolar disorder, or some other personality life issues, or drug and alcohol dependence. Treatment works, treatment saves lives. So don't shy away from seeking treatment. Have a safety net, have a safety plan, have a list of important phone numbers in case you have some problems. Keep that safety plan with you. Keep those safety, crisis numbers with you so that you can call in time of need. Lastly, most of the people who kill themselves successfully are majority of the time under influence of alcohol and drugs. So there's a role for not mixing with these issues. If you have mental health problems, stay away from alcohol and drugs because they will worsen your problems further rather than solve them. Talk to a family member, talk to a friend, talk to a teacher, talk to a friend, talk to a confidant. And if you don't want to talk to any of your known ones, seek counseling from a professional. Go to your, religious figures, whether it's a pastor or a priest or, rabbi or whatever. If you have some linkage with your religious faith-based institutions, rely on them because they are also trained to identify behaviors that can be harmful to oneself. They can be good resources. They can channel you to appropriate treatment services. So my request, my exhortation to young people is that don't suffer silently. Talk about the feelings you have. Talk about the crisis you are going through. People will be able to help you. You don't have to suffer in silence and end your life or try to end your life. Life is too precious. Life is too beautiful to give away. Help is always there. There are mental health professionals. And I will leave at this point in time. So I'm going to sign off. Thank you very much.
Thank you, Dr. Adityanji. And I love the point what you have said is seek help. Yes, whoever you trust, you seek help from them. Is it an expert or a doctor or a professional expert or an organization or a teacher or a religion pastor, anyone who you trust, seek help. And also talk. When you talk about what is happening with your life or your problem, it saves life. So I would like to mention again, September is Suicide Prevention Month. If you ever need anyone, reach out and message. Suicide can be prevented. Talk saves lives. Talk Save Lives is an introductory presentation on mental health and suicide prevention, including the most up-to-date suicide data and research, and what can be done to fight this leading cause of death. Participants will learn the common risk factors for suicide, how to spot the warning signs in others, and how to keep ourselves and our loved ones and those in our community safe. The American Foundation for Suicide Prevention has a program called Out of the Darkness Loudon. I am participating in the Out of the Darkness Loudon experience to fight suicide and support AFSP's bold goal to reduce the suicide rate 20% by 2025. 20% by 2025. Please help me to reach my goal by clicking the donation button on this page, which will be updated. And all the donations are 100% tax deductible, and the benefit, and it will benefit the American Foundation for Suicide Prevention, that is AFSP, funding for research, education, advocacy, and support for those affected by suicide. Please support and save a life. And again, September is Suicide Prevention Month. If you ever need anyone, reach out and message. Now we will have Dr. Mohan to share about suicide prevention.
Can you hear me? Hello, can you hear me?
Yeah. We can hear you.
Okay. Basically, my experience with suicide and suicide prevention is not as vast as my previous speaker, but the little bit of experience I have, the way I look at it is it's a very complicated model where things culminate at the last minute. There are so many things that have been happening with the person. There's the kind of biology he was born with, the kind of interactions he has with the environment, then the psychology, the sociology, and all these things, they kind of culminate to this final moment. And if there's something like a gun in the hand, then it happens faster, and if there isn't, then it happens slower. The only thing I have to add to what was talked upon by our previous speaker is the way people who contemplate suicide, they're not thinking like a normal us. They have so many issues with their body, they have so many issues at home, and they even have so many issues with you as the person they are going to interact with, whether you are on the telephone line. And so their thought process is not necessarily the same as what you or I think at that time. So you have to be very considerate with their thought process. Even though you may feel like they're talking nonsense, it means something to them. And unfortunately, you may not have to understand what they are communicating, but you have to understand that they are stressed out by whatever they're trying to say, and calm down on your side, take 2 steps back and look at the communication process, the communication model that's happening. And sometimes it is beyond you. So that's when you get a specialist into the picture, and that could be 911, the patient psychiatrist, or whoever it takes. Guess I'm done.
Okay. Thank you, Dr. Mohan. And we have few questions to address. Yes, what they say or what we hear is very important. And listening is one thing which is like a challenge. Like we may sometimes miss the call thinking that it's okay, but it's not okay. We never know what is the other person's situation going on. And we have a few questions. Let me start with the first one. What should you do if someone tells you they are thinking about suicide?
The first thing I do is to prolong the conversation. So you get a better picture of what they're thinking. And you also gain time because many times they're not in your presence. So if they're on the phone, you keep talking to them and try to have them talk more with you in terms of, it does not matter what they're talking. They have to just keep talking. And meanwhile, use a second phone or a third phone, or tell somebody to call someone to get to them. 90, I don't know the numbers, but many times it is just a cry for help. But again, you cannot be sure when it is a cry for help and when it is that they're done crying for help. So the biggest thing is to keep having a conversation. Many times by the time you are done with your conversation, half the thoughts will be gone. This business of suicide happens almost instantly. It doesn't linger for days, weeks, and months. Most of the people, they kind of come to a point. That is when they give you their phone call.
Okay, thank you. And we have a few questions from different folks, and we want to keep it anonymous based on the best interest of the stakeholders. So who is at highest risk for suicide in the United States?
One is a person who had a brain injury before, number one, that is the highest risk. Behind that is somebody with a history of schizophrenia or bipolar disorder. Behind that comes somebody with a borderline personality disorder. Behind that is somebody who is on alcohol or drugs. And the list kind of goes on and on. But these are the main ones.
Okay. Dr. Mohan, you are breaking, your voice is breaking a little bit. Yeah. And is it possible to predict suicide?
In a very honest sense, no. But if you know the person well enough, and if he is calling you at that particular time, because it's impossible almost, because it's a multifactorial thing. We don't know what finally pushes him over the edge. So if you're conversing with that person in the last day or 2 or 3 or maybe last few hours, if you can postpone it, if you postpone the act by a short time, then you can postpone it for a long time.
Okay. Is suicide related to impulsiveness?
I don't know, let me be honest.
Okay. What biological factors, if any, increase risk for suicide?
As I told you before, the number one is traumatic brain injury, schizophrenia, bipolar, alcohol and drug addiction. Those are the major biological risks.
So somewhere I read, Dr. Mohan, that even the abdominal pain, like stomach aches, also leads to suicidal attempts, especially in India. That's what they heard.
It does, but it is not the leading cause. It is one of the causes, yes. Pain in general, not necessarily abdominal pain. In many psychiatric diseases, people tend to experiment with different chemicals. One of the biggest reasons why people who have brain injury or people who have schizophrenia or bipolar, they tend to use drugs and alcohol more than the general population. So you find them doing these drugs and alcohol a lot more than general population. Similarly, actually, I have more experience with suicides in India than in US. The people don't necessarily take whatever they take in India because they want to kill themselves. They do it because they want to feel better. And I've seen people resort to all kinds of chemical injection in India for abdominal pain, and they sometimes end up dying. That's a slightly different reason, but that is the majority of the situation in India. In US, there are genuine suicides because of pain, but they're very rare.
Okay. Can the risk for suicide be inherited?
The significant number of those factors, the bipolar is inherited, the schizophrenia is inherited, personality disorders are inherited. There is also something called a paragenetic factor. It's not inherited like genes, through the genes or anything, but you have seen your family member behave like this in this situation. It's called a paragenetic factor. And so, that is a learned behavior, even though it is not strictly inherited, you tend to get it from your family members. I don't know if I'm making any sense.
Yeah, I understand what you're trying to say, yes. So, as you said that, but there is a question to address. So does alcohol and other drug abuse increase the risk for suicide?
The answer to that is yes. First of all, drugs and alcohol can kill you without you trying to kill yourself. They can accidentally kill you, number one. Number two is a lot of people drink alcohol. They are not all alcoholics. Yes. People have experienced drugs. They are not all necessarily drug addicts. There is a certain combination. There is a genetic predisposition and a combination of alcohol, or drugs. So there is a combination where all these factors act together, and then yes, they can contribute to suicidal tendencies or deaths.
Mm-hmm. And like, this is like, yeah.
Famous singer Prince, he died whether suicide or he was doing drugs and he died. It's very difficult to say.
Yep. So, and this, I think even I would like to know the answer. So, do people attempt suicide to prove something or to get sympathy?
Very cultural. There is a huge cultural factor. When I was in India, there were a lot of people who were doing for the second reason. It's possible that it happens here too. but I think it is a minority here.
Apart from talking to suicidal person and encouraging him or her to go for counseling, what else can we do to prevent this?
When somebody is actively contemplating suicide, when you're talking,
Dr. Mohan, your voice is breaking.
when somebody is actively contemplating at this point of time, the biggest thing you can do for him is to prolong the conversation.
Right.
You're not trying to pursue him or anything like that. Your job is, talk, buy time. And so that way. But if somebody has a 5-year plan, then, you may want to convince that life is better and this and that. The feeling of life is not good could be chemical, it could be genetic, it could be so many things. It's not necessarily this, like, my mother died, I'm sad, is different from it's my birthday and I'm sad. So one of them is normal, the other one is, I don't know, pathological, not normal, period. So many times you're not necessarily talking to somebody who is normal, who is using common sense, who is using something. You are basically talking to somebody who is slightly chemically imbalanced, even if it is in response to, I flunked my exam. Even then it could be a chemical imbalance. So you don't know what you're doing at the time. So the best thing for you is to keep talking and buy as much time as you can and let the experts do that. Because even if he is very suicidal, they kind of, let us say, they medically arrest him, take him to a hospital, give him some medication. The medication is not going to be in a system for months and weeks and years. The medication will wear off in 24 hours. By that 24 hours, his moment has passed. And you have saved his life, at least for another, I don't know, 5 years, 10 years, 20 years, whatever. So it all depends on the situation. If somebody feels like, life sucks, then you may want to talk to him and talk common sense out of it. But if somebody is calling you, I am thinking of, or I'm trying right now, then the main goal is to buy time.
Okay. Talk saves lives. Yeah.
Yep.
So why do people attempt suicide when they appear to feel better?
I'm going to go back to the same song I've been singing. Genes, hormones, external stimuli. We don't know. If we knew all that, we would have had a preventive medication for suicide long ago.
Okay. So why don't people talk about mental health illness like depression, bipolar disorder, and suicide?
Okay. The reason people talk about those things are they all cause suicide, number one. But I also want you guys to know that none of those diseases can be treated 100% of the time. When somebody is bipolar for 20 years and he's taking his medication punctually and this and that and everything, there's still some amount of disease that breaks through the treatment. Sometimes it is because of physical stimuli. Many times it is just spontaneous. It just happens. So it just requires the bystanders to understand that something like this is going on, could be going on, and they may need something extra here and there, like a boost, and that would normally save the day.
So just in case, I have this experience with one of the person I know. So they really love the way we had the conversation, and the person said that she would stop taking the medication because now she's feeling, or he's feeling better. But the doctor recommended not to do so until 6 months or the period the doctor has subscribed or prescribed the medicine. So is that the way it has to be treated, even though the person is feeling better or she or he is back, but still they have to follow the medication or prescription?
One, I'm not a psychiatrist, but many of these kind of things are judged.
Dr. Mohan, again, your voice is breaking.
I apologize. I think I'm putting my finger on the microphone. I'm not a psychiatrist, but most of these things are judged in retrospect. So many times, oh, if he or she would have taken the medication, she would have been alive today. That's the way it is looked at. So it is very, very, very difficult to judge, because when somebody is bipolar, when somebody is schizophrenic, and bipolar, you kind of move from I feel horrible today to I feel like the king of the world tomorrow morning. So whether their feeling of I feel fine today, is that normal, or is it one of the bipolar? Is it the manic phase of the bipolar where they're feeling like $1 million today? It's very difficult, for us to judge if we are not in the presence of the patient.
Okay.
The psychiatrists, unfortunately, the psychiatrists are very busy people. They don't get to see these patients when they really need them, because their appointments are 6 months apart and things like that. So it's very difficult for a psychiatrist to judge what the patient is up to if he is not face to face, and give those recommendations to stop and those things.
Okay. I think in this there is another last question I would like to ask, and there's personal note to that. Is it like joint families attempt more suicide? Joint family members attempt more suicide than nuclear ones? Because I was thinking the other way around.
Again, it is very cultural. I've seen that in India. I have not seen it here. I've seen the opposite in US. So it's very difficult for me to say that that's what it is.
Okay. And this is our last question, Dr. Mohan.
I'm sorry. The disease of schizophrenia is supposed to be more in orthodox and joint, in general, more orthodox families tend to be joint families, but the disease of schizophrenia is supposed to be more common among them.
Okay. So is it true that men complete suicide more often than women do? Why is that?
It is actually not true, but men are usually more successful in their suicide attempts than women.
Okay.
I think the rate is about the same, but men are usually more successful in killing themselves.
Thank you, Dr. Mohan.
Again, information is a little bit outdated. I don't know if there's a recent study or something, but that's from what I learned.
Okay. Thank you, Dr. Mohan. So on behalf of the Executive Board and youth volunteers and families of Lead America Foundation and the American Foundation for Suicide Prevention, all along with audience of PILUPutv, we thank you for your graciously accepting our invite and for sharing your knowledge, wisdom, policy matters, and engaging with our vibrant community. We feel enriched and empowered in these challenging times, knowing and hearing from you directly that you have the best interests of the community and are great ambassadors for the good work being executed on behalf of suicide prevention and awareness. We are greatly encouraged and wish to continue the partnership to further the interests of our youth and families. Please remember,
I think I'm losing you.
Suicide Prevention Month. If you ever need anyone, reach out and message. Very importantly, in this profound moment of grief, let us all pray to our loved ones and to the departed souls. Just now we came to know that a Telugu TV serial actress, Kondapalli Stravani, has committed suicide. So please allow a moment of silence. Om Shanti. Please be safe, stay home, and wear mask and save lives. Until next time, thank you very much. Dhanyavad. Shubhratri. Namaste.